Hi everyone, Makoto Trotter, your naturopathic doctor, and I want to talk to you about chronic fatigue and anemia. Anemia is a common cause of chronic fatigue, but sometimes it's overlooked or it's not caught. Sometimes you only have 2 minutes in your doctor's office. So I'll tell you 3 things that you want to ask your doctor for to rule out chronic fatigue, just to make sure there aren't any underlying deficiencies. And I'll give you a bonus one on top of that. So the first thing is hemoglobin. Now hemoglobin is that molecule in your blood that makes your red blood cells look red. It's actually a molecule called heme that's within hemoglobin, but hemoglobin is that bigger molecule that floats around in your blood. When it gets to your lungs, binds to oxygen, carries it to the rest of your body. That means your muscles, it means your organs, it means your brain. You can't survive without oxygen. And if you're not able to carry oxygen as well because of low hemoglobin, low red blood cells, that's called anemia. And that means you'll also feel a little bit tired. And it could be severe anemia or it could be mild anemia, but we want to rule out if there's a problem with the hemoglobin. So your doctor likely will check hemoglobin if you have a chance to mention your fatigue. Sometimes you can only talk about one symptom in your visit, so make sure to emphasize, I've been fatigued for a long time, this needs to be addressed. The building blocks of the heme molecule and hemoglobin are B12 and iron. So those are the first 2 things you want to ask your doctor for, iron and B12. Vitamin B12 is not always checked by your doctor, so mention, I want to check my B12 levels. Iron is called ferritin in your blood, F-E-R-R-I-T-I-N. That's a storage form of iron. That's the typical form that your doctor would check in your blood. So ask for B12, ask for ferritin. The problem with low B12 or ferritin could be because of a diet change. Maybe you haven't had a chance to mention that you don't eat much red meat or that you switched to a plant-based diet a year or 2 ago. This could greatly affect giving you the building blocks in your body from your diet that are able to make hemoglobin. Therefore, you're making less hemoglobin. For women, if you have a heavy period, if you have an irregular menstrual cycle, these are things that can contribute to low hemoglobin as well. If there's more blood loss, there's something like PCOS or endometriosis, you could be getting heavy bleed, and then you're losing blood, and then you're not able to catch up to make enough hemoglobin throughout the rest of the month or till your next menstrual cycle. So those are the first 2 things. The second thing would be your thyroid. Now typically, especially in Canada, doctors are limited by what they can test because it's government-funded healthcare. But the first thing you do want to check is something called TSH, thyroid stimulating hormone. Your doctor can check that in your regular blood work before doing the more detailed hormone analysis. That one, the rule is that has to be abnormal. Then they can do more detailed analysis of your other thyroid hormones. But thyroid stimulating hormone is the hormone that goes from your brain to your thyroid and instructs your thyroid to produce thyroid hormones. Yes, it's in your neck. That's where your thyroid gland is. And it helps you it's basically like the hormones that are in charge of instigating the metabolism of your body. It's like the engine of your body. Think of it that way. So if you're low on thyroid hormones, then your body will be fatigued and won't be able to do its processes as quickly as possible. It might be easy to gain weight or difficult to lose weight even when you're doing all the right things. So TSH is that 3rd thing you want to ask your doctor for. B12, ferritin, and TSH. Now, an extra bonus thing that you might want to check, especially here in Canada where there isn't as much sun most of the year, you want to look at vitamin D levels. Now, that is not covered by OHIP in Ontario. That's our government-funded healthcare. But in where you are, you might have vitamin D covered, or you might have to pay out of pocket. It's only about a $30 test here. But almost everybody is deficient in vitamin D. And we know there's a lot more research on vitamin D, and we're seeing that it can impact energy levels along with anxiety, depression, particularly seasonal affective disorder in the winter months. So just to recap, when you get to your doctor's office, make sure you emphasize, first of all, this is a little bit of a sales pitch to tell your doctor, these are the things I'm experiencing. This is why I need to have these tests done. So talk to your doctor, emphasize how the fatigue has affected your quality of life. It might be work, it might be relationship, it might be social life. And then ask for ferritin, B12, along with the hemoglobin, which your doctor should check, TSH for thyroid, and then the bonus is vitamin D. Hopefully that gives you some answers, and then those are things that can be easily correctable. All right, good luck, and hope you feel better soon.